Hello, I'm Justin Gallagher, Associate Publisher of the American Journal of Managed Care, and welcome to This Week in Managed Care from the Managed Markets News Network. Our top story this week comes from Health and Human Services, where a new study found that competition among top health plans under the ACA helped consumers find the best prices. There were more 2015 marketplace choices for consumers than in the previous year, increasing competition among health plan providers. In 2015, 86% of households had at least 3 options for a qualified health plan, up from 70% of households in 2014. However, HHS Secretary Sylvia Burwell questioned whether the unions of Aetna and Humana and Anthem and Cigna will decrease competition in future years. The potential consolidations between these 4 insurers would reduce the top 5 healthcare insurers down to 3, and could affect competition levels that in 2015 led to better prices and premium levels for consumers. Primary care physicians are unhappy with the increased use of quality of care metrics, according to a survey from the Commonwealth Fund and the Kaiser Family Foundation. Half of primary care physicians say metrics used to assess the provider's performance have a negative impact on quality. 52% of primary care providers also disagree with the programs that impose financial penalties for unnecessary hospital admissions or readmissions. Yet, many physicians said health information technology has had the opposite effect. About half of primary care providers and 2/3 of nurse practitioners and assistants see a positive change in their ability to provide quality care due to the advances in health IT. Dr. Lisa Hicks spoke to AJMC about presenting quality data to physicians at the American Society of Hematology annual meeting.
I think we also need to focus on being able to provide data to physicians that reflect their practice in a non-judgmental, non-punitive way. Physicians are creatures of data, right? We all came out of a quantitative model. Most of us love looking at spreadsheets. We love looking at graphs and really getting into the data. And whenever I've presented data back to a group of physicians about their practice, they are eager to see it. They want that data, and many practice environments don't provide that. But the key is to provide it in a non-judgmental, non-punitive way that doesn't shame physicians.
Kaiser Health News predicted this week that a total of 2,592 hospitals will lose a combined $420 million due to penalties imposed by Medicare because of their readmission rates. The Hospital Readmissions Reduction Program, which encourages hospitals to pay closer attention to their patients upon discharge, has led to a reduction in readmission rates over the last 4 years. However, 1 in 5 Medicare patients is still readmitted to the hospital within 30 days of discharge. 38 hospitals will receive the maximum payment cut of 3%, while a total of 506 hospitals will lose at least 1% of their Medicare payments. A recent survey from the Employee Benefits Research Institute shows that traditional health plan enrollees are more satisfied with their coverage and out-of-pocket costs compared with patients enrolled in consumer-driven health plans and high-deductible health plans. Consumer-driven and high-deductible health plan enrollees were less likely to recommend their plans to friends or coworkers than traditional health plan enrollees. Both consumer-driven and traditional health plan enrollees reported higher levels of satisfaction regarding the quality of care they receive than high-deductible health plan customers. High-deductible health plans have grown in popularity as people become increasingly concerned about rising healthcare spending. At the 2014 Value-Based Insurance Design Summit, AJMC co-editor-in-chief Dr. Michael Chernew highlighted some of the issues with these plans.
Traditional insurance pools a lot of people together, the healthy and the sick, the rich and the poor, and these types of plans don't necessarily do that. And so if you happen to be very sick, the benefit design in a high deductible plan may not help you because you're basically going to spend through your deductible, not save any money, not have a lot of opportunities for savings, and the subsidy you might be getting from the healthy people in the traditional model you now might not get because the healthy people are capturing the savings associated with them using less care.
And finally, the CDC predicts that drug-resistant infections and C. difficile will increase if nationwide improvement measures in infection control and antibiotic prescribing are not implemented. Antibiotic-resistant bacteria currently cause about 2 million illnesses and 23,000 deaths each year in the United States. CDC Director Tom Frieden said that coordinated efforts by healthcare facilities, nursing homes, and public health departments could eventually reduce these infections and improve antibiotic use and infection control. A coordinated effort could prevent nearly 619,000 antibiotic-resistant and C. difficile infections and save 37,000 lives in the next 5 years. The CDC Vital Signs Report offered 2 recommendations. First, that public health departments track and alert public health facilities of outbreaks and drug-resistant germ threats. And second, that various healthcare delivery facilities implement shared infection control actions to stop or minimize outbreaks. For the Managed Markets News Network, I'm Justin Gallagher. Thanks for joining us.